Good evening, everyone. I am Dr. Aman Khera, co-founder K4Parents, and I welcome you again today on a very interesting, a very relevant, and a very important discussion on Omicron. It has been now almost 2 years when COVID-19 has been infecting the humans and has impacted everybody's life. Never in the history have we ever, in our medical history, we have ever experienced such a situation in which we are even scared to go out of our house. ऐसा वक्त कभी जिंदगी में हमने नहीं देखा, हमने इतिहास में नहीं सुना कि ऐसी कोई बीमारी आ जाए जिसके कारण हम घर से बाहर हमारे को निकलना मुश्किल हो जाए या घर से बाहर निकलने से डर लगे। ये नाउ एक बड़ा इंपॉर्टेंट क्वेश्चन आता है कि ये कोरोना वायरस या कोविड-19 क्या है, क्या चीज है। कोरोना वायरस एक्चुअली कोई नई बीमारी, नई वायरस नहीं है। कोरोना वायरस इज अ वेरी ओल्ड वायरस, इट्स अ ग्रुप ऑफ वायरस व्हिच हैज बीन प्रेवलेंट इन द नेचर फॉर अ वेरी लॉन्ग टाइम। अब वायरस का एक इनहेरेंट नेचर होता है दैट इट फॉर्म लॉट ऑफ वेरिएंट्स। So COVID-19 was the variant of coronavirus which started infecting the humans about 2 years back. And that is when it started impacting the lives of everybody. We all remember जब COVID-19 start हुआ था, so there were a few variants called the alpha variant which started infecting the people about 6-8 months back. We all remember from somewhere in month of March and April, the Delta variant came. Delta variant was one of the most dreadful variants which we have experienced, because it was affecting everybody. It was spreading very fast, and we all know that Delta variant actually impacted everybody's life. A lot of people were affected. A lot of people lost their lives. A lot of people lost their near and dear ones. And it became एक dahshat बन गई थी कि अगर if we go out, we'll get infected or the Delta variant is going to affect our life. This variant lasted for a few months, 3-4 months. Gradually, as we say, the wave settles down, the number of infections started reducing. We thought that probably better times are coming. We thought that gradually now this infection will go down, it will become endemic, people will become immune to it, and hopefully our normal life will return. Suddenly, from nowhere, we came to know that a new variant has come up about 2 months back, 2.5 months back, which was by the scientists called this Omicron. This Omicron, again another variant of COVID-19 virus, is also spreading much faster than the Delta variant. And again, the fear started coming in our mind. Now what? How do we prevent that? A lot of questions come in our mind कि आगे क्या होगा? डेल्टा वेरिएंट से अभी हमारा पीछा छूट रहा था कि एक नया वेरिएंट आ गया. How is that going to impact our lives? A lot of questions come in our mind, especially for the elderly, and not only for the elderly, for everybody. As a matter of fact, even for the young children, for the youngsters, that how is this Omicron going to affect us? A lot of questions come in our mind. I have already had Delta variant, Delta infection. Will I get Omicron? Am I immune to it? I have got my 2 shots of vaccine. Can I get Omicron virus? Can I get infected again? My neighbor has it. What is the possibility that I will have it? What are the symptoms? What are the dangers? Lots and lots of thoughts come in our mind, and there are lots of questions which are there. And they are very relevant because we do not know. The future is totally uncertain. We do not know whether this is going to, will there another variant come? Nobody can, even the best of the scientists cannot answer these questions. But yes, the doctors and the scientists and the medical research teams are working day and night to understand the impacts, to see how to reduce the impact of this virus, and to educate the people what to do and what not to do. So this being a very relevant topic, today we have invited Dr. Charu Goel, who's the head of Department Internal Medicine and leading the COVID team in Manipal Hospitals in Delhi. She has been treating a lot of COVID patients, and I I want to thank her because this is the second time when she's coming on our this webinar to discuss about COVID-19 and its impact. Thank you, Dr. Charu, for joining in. It's up to you. Starting.
Thank you so much, Dr. Khera, for having me here. It always is a pleasure to be part of this Care for Parents family, and I'm always delighted to be here. And yes, just as life was coming back to normal, we thought that the devastation of the Delta wave is over. We were all resuming our normal activities. We were hit by this Omicron virus, which is a COVID-19 variant virus of concern. Emerged in South Africa last year and in November. And why it became a variant of concern was because it was noticed that it was highly transmissible. In fact, it is probably 10 times more transmissible than the earlier Wuhan strain. So it's very transmissible, very infectious. There's definitely even a shorter incubation period. And certain symptoms were seen which were a little different from the earlier Delta variant. So we went into the third wave. We saw an exponential rise starting from South Africa. It emerged into a lot of countries, came to our country in a big way. We were a percentage rise starting from 0.6% to December to now 17.3% positivity. So almost every second, third house seemed to have been affected, and families were being affected. And people were getting symptomatic. Even in the OPDs, I was seeing people coming to me with symptoms, and we could easily say, yes, probably they're having, COVID infection. Soon the Omicron actually took over, the Delta variant as well. And there's been a lot of suffering, people having to take leave from their work. A lot of rules had to be put by the government, like presently, of course, it's been now relaxed, but we were having, weekend curfews, restaurants were closed, or even opening of the markets, because so many people were getting infected, families all together infected, neighbors, everyone. And but of course, we had a lot of learning from the experience that people had in South Africa, in Europe, and other places. And what we saw was that the severity of this infection was a bit less compared to the Delta variant. Of course, keeping in mind that what the vaccination status is. So what they had studied is that people who were who were hospitalized or who required ICU care were people who were probably partially vaccinated, or people who had other comorbid conditions which made them succumb to the disease. But people who had been vaccinated had less severity of disease. So that is one thing. So this, of course, variant of concern was one because yes, it was very infectious. People were getting infected despite a high seropositivity of COVID infection. In India, many people have had COVID infection, so there's a high seropositivity. We were more forthcoming with the vaccination, unlike many countries abroad where people were reluctant to take vaccinations. Out here, many people are forthcoming to take vaccinations to the point that we've crossed 1.6 crores, people being vaccinated. So, and that was a very good thing. So I think that led to less severity, of course, that we have seen, here in India. And as per my experience, what I saw was people had mild symptoms, the common ones being, of course, fever, cough, running nose, lower backache. Okay, so there was not so much of loss of smell, loss of taste, but yes, one thing very peculiar to this variant was people were complaining of a lot of chills and a lot of headache. So that was one thing, and severe musculoskeletal pains. So that is one thing we typically saw with this variant. And these symptoms lasted typically from like 3 to 5 days. After that, they would start showing a recovery. We mostly had to just give them symptomatic treatment. And with that, many of them recovered. But yes, it was spreading so fast that if one person had it in the family, then the other in the family were bound to have it. So this is what we saw, we've been seeing typically now, even in the hospital, in the outpatient departments, that people have been coming with these mild symptoms, but luckily we could manage many patients from home. There were certain patients who required admission. There were people who had certain comorbidities, like people with chronic kidney disease, chronic liver disease, heart disease, people who, there were people who were having a little saturation sometimes. So we didn't see much of lung involvement this time. So, but then, people having comorbidities and people, who were not vaccinated, they were the ones who required hospitalization and even required critical care, care at that point in time. Compared to the Delta variant, of course, there was less severity. Symptoms lasted shorter compared to the Delta. Okay, that was one thing. And I think mostly we did not require much of specific antiviral treatment that we needed to give. Most people recovered well with the symptomatic treatment.
So what we understand is that this variant has been a milder variant and had been, requiring, let's say, more of a symptomatic treatment than a very specific treatment. And luckily, the number of hospitalizations had been very, very less as compared to the previous variants.
Yes, absolutely. So that is one thing that was very reassuring. Though, of course, the transmissibility has been so high with the exponential rise that a lot of people were every second, third person walking in the OPD seemed to be having the infection. So there was a lot of morbidity, and even many of the doctors suffered from the infection. We were short of the staff as well in the hospitals because we had advised everybody has to be on a 7-day quarantine. So, there was a lot of leave that had to be taken. So, of course, now we are at a stage where many people aren't even getting tested because people tell us that, we are having symptoms, the whole family is having symptoms, they are not going for testing. They're just preferring to stay back home.
So Dr. Charu, what do you, as per for your experience, compared to the previous Delta variant, what protection or what are the measures that people should take, or the elderly, especially the elderly, or even the youngsters should take, so as to prevent the further spread or maybe getting that infection?
Yes, so most important, following appropriate COVID protocol is very important. So we cannot, do away with the mask. That's number one. A lot of people come and say that, I've had COVID before, I'm vaccinated. Why is the mask important? I will not get infection. That is actually a myth. You can always get reinfected. Okay, so of course you cannot do away with the mask, and also wearing the mask in a proper way. You see many people wearing the mask which is loose, not properly fitting, under their nose. That's not the way. And of course, in our country, it may be slightly difficult, but as much as possible, following the social distancing would be important. Hand sanitization is very important. Washing of hands, not touching your eyes, ears, and all, eyes, nose, and mouth, with infected hands. So repeated washing, that's very important. If you're coughing, then following the cough etiquette, that you cough in a handkerchief, don't cough out without the mask onto other people. So those things, still hold good. And that is one thing that is actually, will help in preventing the transmission, because what we have seen is that now this variant has gone into community transmission. Okay, and the longer a virus stays into transmission, the more chances it has to mutate as well. Right, so we have to, kind of put a stop at that. And mask is and of course, I would urge everyone that vaccination becomes very important. What has reduced the severity of disease, I think vaccination is a very, very, very important thing that's happened in our country, that has helped in reducing the severity of the disease. So that's very important.
Dr. Charu, a lot of people who have had vaccination also have been, had become positive. So what is eventually the importance of vaccination, and if one has to get infected or one gets infected despite getting the vaccination done?
Okay, so this Omicron has many mutations, more than 50 mutations. That is what helps it to evade the immunity imparted by the vaccination. So it has a lot of mutations in the spike protein. So what happens is you have a chance of getting reinfected. But data has shown us worldwide, and even research being done in our country, that the severity of disease is much less if you are vaccinated.
So that means, I mean, this is a very important message for everybody, that your vaccination, although people may develop Omicron infection after vaccination, but vaccination is still very, very important, because that reduces the hospitalization frequency, as well as the chances of getting a serious disease, if that is so.
Yes, sir, absolutely.
So this is a very important thing, for everyone,
yes,
that if you are not vaccinated, please get your vaccination done. even if the people are getting infection after vaccination, but the importance of vaccination still holds good. Dr. Charu, what I would like to ask you one thing is, in your experience, how has the course of disease been in elderly compared to the young or the middle age group? What have you experienced, and what precautions should be taken?
Okay, so many of the elderly patients who would come to us even in the OPDs or video consult with us used to have a lot of body aches. That's one thing. So that musculoskeletal symptoms were more, I felt more, this is my, as per my experience, was more prominent in the elderly patients. That was one thing. And of course, most of them complaining of lower backache, one thing. And of course, we used to see more of high grade fever in the younger age group, not so much of high grade fever here, but sore throat, running nose, cough, cold were the common symptoms. Headaches were common symptoms. Then a little fluctuation with blood pressure and sugar levels was more obvious with the elderlies. So we were very careful with our elderly patients, that we would tell them that constantly monitor your oxygen levels. That's very important. Constantly monitor your oxygen levels, your heart rate, your blood pressure, your sugar levels. That's very important. And if it is going below 93%, then please, come for admission. And if you're having any kind of chest pain, any giddiness, any severe bursting headache, we would tell the family members if they seem to be getting drowsy. So because sometimes what happens is, this disease itself may not be severe, but it can lead to a severity of the underlying condition. So these are the few things that I've experienced, that many of my elderly patients who had some comorbidities, once this infection occurred, that comorbidity worsened a little bit.
So that's a very important thing, because in a country like ours, where the conditions like heart disease, diabetes, high blood pressure, post-stroke, people who have experienced that. So there's a very high prevalence of these type of situations, these conditions, and a lot of people suffer from these chronic diseases. So it is actually very important that these people who have these diseases in their history should be extremely careful about the management of their Omicron if they get infected.
Yes, sir, absolutely, sir. And it's not difficult. And as we keep guiding them, we tell them that you stay connected with the doctor. If there's any doubt, please don't hesitate to get in touch with us. We are always there. Any kind of new symptom that you see coming up, like many patients, elderly patients, are telling us that we feel a bloating sensation. Sometimes there are diarrheas. Sometimes there's constipation. So that symptom can sometimes be very troubling. So we tell them that you please get in touch with us. If there's any problem, you let us know. And for 7 days, we will stay connected with you and observe a good 7-day isolation. And most of them do recover pretty well.
No, this is I think this is a very important thing what you have said. You see, because even we have come to know that people think that yes, it's a mild disease. जुकाम होता है, खांसी होती है, ठीक हो जाएगा, 2 दिन का बुखार है, ठीक हो जाएगा, it will get all right. But it is important to remain in touch with a specialist, because you never know when the situation may turn and what type of odd symptom may come out, which we are not aware of and which we tend to neglect. That's a very, very important thing. Dr. Charu, there's another question on the globe that for children, small children, like a 2-year-old child, what could be their symptoms and what would be their presentation?
Children generally tend to have very mild symptoms. So many of my pediatrician friends would tell me that most of children would have a little bit of a maybe sore throat, a little cough, a little cold. Families that have been infected, because children have to stay with the parents, and if the parents are infected, you can't tell the child to stay away. But they don't generally. This time we've seen they're not having very severe symptoms. Little fever, which is lasting for about 3 to 5 days. So in children, the symptoms are much less severe.
And possibility of getting complications are much less in that.
In less, is less, absolutely.
At least that's very reassuring.
Yeah.
Also, I would like to ask you one thing, that people are not, after they feel better, they are not getting the test done to check whether they are still positive or not. Or is there any relevance of getting a test done, repeat test done, to check whether they are negative or positive after 7 or 8 days?
So as per the government policy, no retesting is required. So retesting is definitely not required once you have observed your 7-day period of isolation. From the time you've been tested, no retesting is required. So even in the hospital, when we are discharging patients, we are not retesting them. We're telling them that you stay at home, preferably stay at home for another 5 to 7 days of isolation until you become completely, your cough cold settles, and you feel up to the mark. So there is no role of any retesting that is required.
So that is again a very important thing, because a lot of people get panicked and they tend to go for repeat testing. So as per the government guidelines also, and as per the doctors also, that 7 days isolation is what is considered averagely a period of isolation, and need not have any further isolation unless there are symptoms or unless there is a problem. Do we expect more variants to come? Which of course nobody knows. But as per your experience, what do you feel? What is going to be the future of this particular virus?
So I feel that as long as this community transmission stays on, COVID is notorious to mutate. Actually, all viruses are notorious to mutate, but this virus especially has been mutating pretty fast. So the longer it stays in the community, there is a possibility it will continue to mutate. We are, probably a little luckier that this is a milder variant, in the sense it hasn't caused much of severity. But of course, a lot of reasons can also be there because of the vaccination and all those things that could be a contributory factor. But it can always mutate. So we can never really go off guard. And I think the one thing that will really protect us is vaccination. So good that the booster dose also came into being. And front care health line workers, as well as elderly above 60 years having comorbidities, were vaccinated. So that was a very, very good step, because many people have taken their vaccinations much earlier, and then there are many people who have not really been able to get a good immune response. So because of this waning immunity, the booster dose is also a very effective measure that has been taken. So probably we'll have to keep on getting vaccinated every year.
So you just mentioned about the booster dose, and we got a message that there's a person who's requesting who got a query that I took 2 vaccines plus a booster in September, and October end he developed COVID-19 positive, mild attack, and recovered by October 2021. So the question is that will any further attack happen in near future?
That is actually very difficult. Yes, reinfections can happen. There's no doubt about that. But what we are always stressing upon is that the severity of disease will always be low after you get vaccinated, because not only do you develop immunity in the form of antibodies, also you have these T cells in your immune system, which are the memory cells that recognize that particular virus. So you may get like a flu, we can keep getting now and then, but the severity would be less. The disease severity would be less, so you may just end up having mild probably upper respiratory tract symptoms, mild running nose, mild cough. So absolutely there is no guarantee that if you're completely vaccinated that you never get infected again. At this point in time, that's not there.
So that means that the risk will always remain, whether we are having our booster or not, and whatnot. I mean, as the variants may increase.
It's just that now we feel that we have to live with this situation. Life has to carry on. That's also very important. But as long as we are following all the safety measures, keeping our precautions, we can, as much as possible, continue to lead a normal life.
That's very interesting. One more question somebody is asking is that how long does this Omicron stay on surfaces like napkins, clothes, or in the atmosphere? Suppose there's a closed atmosphere like a elevator lift. So how long does the virus tend to stay in that, and how long does it remain infectious?
It can stay for a while on surfaces. That has been seen earlier in the COVID study also, on the wooden surfaces, sometimes even 3 to 5 days. On cloth, it can stay for 3 to 5 days. In the air, it can stay suspended. In fact, there was some recent literature that said that, for about an hour or two, it can be there. So very difficult to really actually say how much exactly, but it also depends on the quantity, on the dispel of the virus, that is also there, how much of viral load there is. That also varies from place to place. So that's why we say that, if you are COVID positive, or even if you're having a gathering in the family, it should be in an open ventilated place. So because, a crowded place would lead to more of viral load. So we tell that patients who are sick, should be in a good ventilated room as well. That's one thing. And like recently, there have been gatherings, and also if that is mandatory, of course, we urge everyone, especially our elderly people, not to step out much, not to, go into gatherings at this point in time. But if something cannot be avoided, then to be in a probably outdoor space, in an open space, so there's less chance of carrying the infection. The wind blows it away. It doesn't stay in high concentration in the air.
So that's very important. Come what may, whether we take vaccinations or not. I mean, of course, we should take vaccination. The COVID appropriate behavior is very important. To prevent and to this we call a new normal life, not an abnormal life, but a new normal where we have to wear mask and maintain distance. I think it's going to stay here for a long time. That's Dr. Charu. One more thing which is coming in my mind as we are discussing is that after the Delta variant, the doctors had realized that there had been a lot of post-COVID, complications or symptoms which persisted even when the patients were, became negative.
Right.
What has been your experience and about Omicron? That how has the post-COVID period been? Have there been any problem, any other systemic, any other organ involvement problems? What has been your experience in that?
So this time, luckily with Omicron, of course, because it's been very new, a lot of the time has to pass by for us to know. But after the Omicron, people are not really complaining of, any long-lasting symptoms. Like with the Delta, people would continue to have fever for some time. There were a lot of long COVID, symptoms like, people having fever, body aches, mental symptoms, mental irritability, cardiac symptoms like palpitations, those kind of things were there, which are still troubling people even now, especially, because the Delta variant led to a lot of lung involvement. So, breathing difficulties, frequent infection. Now, this thing we haven't seen so far with the Omicron. So people who recover pretty well do recover completely. Of course, they do complain of, a little lingering weakness, little lingering body aches, a little tiredness. But it's really, as far as now present is concerned, it's really not as bad as how we have seen with the Delta variant. Of course, yet is to be seen when we follow up patients.
So that is, I think, a bit reassuring that the post infection, the effects are so far as what we have come to know that they are quite less as compared to the previous ones. Also, Dr. Charu, some people were asking that in the previous times, during the course of the disease, a lot of investigations were being done, like the CRP, D-dimer, and some IL-6 and other investigations were advised by the doctors, and some were getting it done on their own. So in this Omicron infection, what is your opinion about whether these tests should be done? If at all yes, then when, and if no, then then why not?
For mild cases, I don't think we really need to. If anybody is young, doesn't have any comorbidities, has mild symptoms of the viral infection, I don't think any testing is required. But if anybody has certain comorbidities like renal failure, liver failure, cardiac disease, then we do, advise them to get certain tests. Any, probably breathing difficulty or any symptoms, then we do tell them that, you can get a couple of inflammatory markers for us to see, what is the level of inflammation. But as a routine, for our patients, we are not recommending it to everyone.
That's very good. Actually, that's very reassuring again that the amount, the tests that have to be done need not be done. Actually, what were being done in the previous way. Anybody else would like to ask any questions? Anybody has any in mind?
Yeah, I sent one message. I'm from Singapore. I had two vaccination. That is last October, before October 2021, and after that September, I had a booster also. October end, I was suffered COVID-19 positive. Is there is any possibility after a short while mild attack, then it is after 1 week it will be recovered. So is there is any possibility again it will come?
Yes, sir. So we have seen reinfections. I mean, with Omicron, we have seen. Now we don't know. It's yet to be followed up whether if anybody's had Omicron infection, whether they get reinfected by the Omicron itself. But yes, the viral transmission is very much in the community, and there is absolutely no guarantee that one can say that one cannot get reinfected. But if you are vaccinated, the severity of infection will be very less. It might just pass off like simple flu symptoms, might not stay for longer. So that might be one thing. But we have seen reinfection with Omicron. People who have had Delta infections before are having Omicron infections. So reinfection, yes, is occurring.
Is it, Dr. Charu, tell me one thing. Is it true that a person who's vaccinated may not suffer from an infection but can be a carrier and may transmit to others?
Yes, that is possible, sir. Yes, absolutely, it is possible, because we have a lot of asymptomatic patients. They may not have any symptoms at all, and a large number of those asymptomatic patients are present in the community, so they could very well spread the infection.
So that is a very, very important thing which we all should realize, that even if we are vaccinated, there is we have to, the importance of, again, the COVID appropriate behavior should be there, that we have to wear a mask, because even if we are vaccinated, even if we have had an infection, we can have it again probably and carry the virus, may not have the symptoms and spread to others. So that is a very, very important thing, which everyone should realize, that these situations are possible. Also, there are some questions on the chat box, like, how about children who haven't been vaccinated, or maybe teens who have not been vaccinated?
So yes, I think in due course, vaccinations would start for younger children as well. And of course, for the 15 to 18 years, it has been already started. So, Covaxin has been given in our country. Now, for younger children, yes, because, eventually we would want them to return to school. So, though they may not be infected severely, but they can always work as carriers, right? So that is one thing. So, of course, apart from the fact that we want them to be protected also, and we want them to get back to schools fast, they can also always be an asymptomatic carrier. So vaccination in due course, I think, will start with for little children as well.
Hello.
Yes, please.
I am Rajinder Gupta from Jammu. I have had my two vaccine dose earlier, but now my third dose is due in 3 days. But presently I am having a bit of this running nose and some cough, very mild. But so should I go for a test or get my third dose?
I think you should go for a testing first, sir.
Okay.
Because if you're having any symptoms, no? So because if somebody has had COVID infection, then of course booster is not immediately given. It is given after a period of 3 months.
Okay. Thank you.
Please get yourself tested first to ensure that are you having a COVID infection.
Okay. Thank you.
This is very important, actually. This is a very, very relevant question, Dr. Charu, that suppose somebody has had his or her 2 doses, or maybe just 1 dose, and then the second dose is due, and just around that time, if he or she develops an infection, then the next dose should be deferred.
Yes.
Deferred by about 2 or 3 months, it should be deferred, so that then the next dose should be given about 2 or 3 months later. That's a very, very important thing, because people don't realize that, they don't understand that, and they ask everybody that what to do and what not to do.
Absolutely.
There's a question which is asking that are the home testing kits giving correct results? What is the efficacy, or what is the positivity of the home testing, what we call the rapid antigen?
So if they're positive, then yes, we are taking them as positive, But yes, there are false negatives also with the rapid antigen test. So if you're symptomatic and it's showing as a negative rapid antigen test, then we do urge you to get an RT-PCR. That should be done. So the most accurate test is an RT-PCR test.
There is one more question which says that the general rule of 7 days isolation and no testing, but there has been an instance in which somebody and her husband and son both were positive even on the 10th day.
So this actually RT-PCR can even pick up viral remnants. So it may not be an acute infection; it just could be picking up the viral remnants. So in all probability, they are not infectious at that point in time.
So that means that on 10th day, if somebody is positive, means that there is, because that some dead virus or viral remnants are there in the blood, which are probably being, or in the secretion, which have been detected. And but the patient as such is not infective at that particular.
Yes.
That is a very important thing again, because people feel scared that it's positive, I want to stay in isolation. 10 दिन हो गए हैं, मैं क्या करूं? So that is a very important thing, that if even after 10 days you are positive, you tendency of being infectivity, spreading infection is not there.
Yeah.
There is another question which is asking that, doctor, do you advise antigen test before booster or a vaccine, booster dose or a vaccination?
No. Only if you are symptomatic, then you should, get a PCR or testing. Otherwise, it is not advisable. Definitely not. I think, all these kits and this PCR testing should be very judiciously used. We should not, many people would be just, stocking these antigen tests and all that is not required.
So basically, test only if you are symptomatic. If you feel that you are having a problem, you are suspected to have a COVID, and suspected means not that you have an exposure to somebody, but if you have the symptoms, then you get yourself tested. This is a very important thing.
Hello, doctor.
Yes, ma'am. I can hear you, ma'am.
I wanted to ask one question. My sister, she took Covishield from here. Then in the meantime, suddenly she had to go to US. There she took 2 doses of Pfizer. Okay. So already a Covishield and 2 Pfizer doses she has taken. Now she is not 60, but when she, shortly she is going to be 60. Then at that time, booster dose she is supposed to take, or she can skip it. Already 3 doses are there.
I think she can skip it now at this point. If she's taken 3 doses, she can skip it. As of now, we are just restricting to the booster dose, to the first booster. I don't think there's any requirement of taking more boosters at this point in time.
But anyway, I just wanted to know if a person has taken 2 shots of Pfizer, then if they are in India, which vaccine they are supposed to take as booster?
See, out here, we are giving only 2 vaccines, either Covishield or Covaxin. So,
if a person has taken Pfizer 2 shots, in that case?
They can take Covishield or Covaxin.
Either of this.
Yeah, either of them. That needs to be followed up.
I had some blood tests done. So in between, they had also done this antibody test. It showed 4,000. So my doctor was telling you have got good antibodies.
Yes, ma'am.
Charu, this is what I was going to ask. There's a very, very relevant question also on the screen, and was in my mind also, that a lot of people getting, after the vaccination, go into that drive of checking their antibody level. My first question is there a relevance of that? Secondly, there have been a lot of instances which I have personally seen, as well as the person who has written on the chat box, is that even after taking 2 vaccines, the antibody in the blood is coming 0. What is the significance of that?
Actually, there is no point in testing the antibodies. And even if the antibodies are good, you can still, get an infection. This is one thing. Of course, the severity could be less, and it depends from person to person. So it varies from person to person. Some people don't, build up as many antibodies, and then there are certain category of people who are, immunosuppressed. And I think that is why the booster doses have, come into play. Immunosuppressed. There are people, who have not been able to mount an adequate response after being given a vaccination. So for them, of course, the booster doses work well. But doing a check on the antibodies is not advisable. It's not required also, because, generally it gives a false sense that now you are protected and you're safe, and people go off guard. So that should not be it. There's no point in doing it. We should follow the protocol of vaccination, of course, COVID appropriate protocol, and that's how, we can remain safe.
That's very interesting, because a lot of people go for antibody tests, and it's like a race, that who has got more, and it's like a competition that I have got more.
And the people who don't have it get very psyched that, oh God, I don't have it. What do I do? So, we are, this is, of course, now not so new, but still I would say a new virus. We don't know how it's going to behave in future, how many times it's going to mutate. From what we are seeing now, it continues to mutate. So there should be no, false sense of protection that we are safe without, our vaccination, or we are safe without our COVID protocols. But those things are here to stay now.
I just wanted to know, so if someone who has tested for antibodies and found that it's 0 after a vaccination, what should they do? Should they go for another vaccination or just take a booster?
They should know, but the booster is indicated for a certain, group of people. Yes, booster would be advisable. Yes, after a certain period of time, if it's been about 9 months to your last dose, a booster should be taken. We are giving boosters to patients, but preferably as of now, it has been to healthcare workers and people having comorbidities. So gradually, of course, it'll extend to the rest of the population as well. And yes, boosters would be required. In fact, time to time, maybe every yearly, we would require to have our vaccinations done.
Correct me if I'm wrong, Dr. Charu. Personally, I feel that booster is now going to be a part of our life, and maybe maybe once in 9 months or once in a year, everybody at any time will be requiring a booster to.
Yeah, I think so. I think it will, very. As of now, see, the priority remains is that everyone gets at least the second dose of vaccination. So in a country like ours, priorities are very important. We have to prioritize it. Right now, vaccination, people have not received the first vaccination, people have not received the second vaccination. Priority lies that they have to be fully vaccinated. Then of course comes the booster. So
and the frontline workers like you should be also well protected, because if you will get sick, then how will you and the frontline workers be able to?
I think yes, as doctors, it's very important because we should be available for our patients to treat them.
Absolutely.
Rather, so that's very important that we all stay protected. Yes.
So definitely, this has been a very interesting discussion. Anybody else would like to ask any questions?
I have a question. My name is Ruchi Mohan. I'm Sachin's sister. My mom is here from India. She got 2 Covishield vaccines, and then we got her a Pfizer shot in Paris. She's visiting me. She's supposed to go back. So we just got a PCR. India needs those 72 hours prior to travel.
Yes.
They want the PCR test. I was told by someone, even though we've not been exposed, and we're pretty sure she doesn't have COVID. None of the family members have been diagnosed with it. But my concern is in the time that she's been here, if she has been exposed and she's asymptomatic and the COVID and the test results shows positive, because I'm told there's a concept of long COVID and your RT-PCR test could come positive even though you're asymptomatic or you may not have COVID. In that situation, how is the Indian government handling it at the airport? Does she need a note from the doctor? If we do an antigen test and she tests negative, would that be recognized? How does it work?
We are doing it for many of our patients, who have to travel. Like for them, it's urgent to travel. Like some people have been in a country, they have undergone a home isolation period of 7 days, and still tested positive. So
Right.
then, as a doctor, we do give a note to them saying that
Okay.
as per the Indian guidelines, a home isolation period has been covered. They are asymptomatic. They are not having any fever for the last 3 days. No oxygen requirement is there. So they should be allowed to travel. In fact, in countries abroad, I think people are keeping a lesser home isolation period and then stepping out with a mask.
So no, my question is, in Paris, if I go to a doctor and get a note like that, if heaven forbid she does her PCR test comes positive, would that be okay at the airport when she's traveling back? Because her visa is also expiring. She cannot stay here longer. So what do you think is the protocol?
I think they would advise for a quarantine.
When she lands, yeah, she'll quarantine for about 7 days. That's what's required in India. But the point is, will she be allowed to travel with a doctor's note and a positive PCR?
I think if it's given as a traveling from there, perhaps over here may not be. If it's a PCR positive, may not be allowed.
Okay.
Yeah,
Okay.
yeah.
And then, again, a week later, she does a PCR test and it again tests positive. Then what do you do?
It's generally a little quite rare for that to happen. So after some time,
but I've heard it does happen. It says there's a thing called long COVID, and you just keep testing positive no matter what.
Long COVID is just that long COVID is not related to your PCR. Long COVID are symptoms that you experience even if your PCR is negative. So
Okay.
long COVID is a different thing. But yes, maybe as per protocols, if somebody is positive, then traveling may not be easy. There might be a hesitation on that. But yes, we can be detected positive, but after some time, maybe after 10 to 14 days, it does eventually become negative. It doesn't stay positive for too long. Not especially this Omicron doesn't stay positive for too long.
So you can't do a PCR test and if it's positive and then do an antigen test and that's negative, the Indian government won't accept that at the airport?
The PCR test is accepted more than the antigen.
Okay. All right. Thank you.
Okay.
So it has been a very interesting discussion today, and where we, Dr. Charu, had been, has told us about what all to do, what not to do, how to. The most important thing what she has said is that come what may, whether it is a light variant or a dangerous variant, the COVID appropriate behavior has to continue. Whether we are vaccinated or not, the possibility of getting infection is there. Even if we do not have symptoms and vaccinated, we can be carriers and we can spread the infection to others. So we should not take this thing very lightly. It is these things are very important, and these are the takeaway points that we have to remember. And we hope and pray that this also subsides and no new variants come up. It becomes terrifying when we read in the newspapers that some other variant is coming from some other part of the world. We've all become very scared, and we really hope and pray that this tension should subside now. So thank you very much everyone for joining in, and thank you Dr. Charu for coming again, because I remember last time in the month of May you had participated in our discussion, and you had given a lot of insights about the Delta variant at that time, and I hope we meet again, but not for COVID, maybe something else to discuss.
Always a pleasure to be here, Dr. Khera. Thank you so much for making me feel a part of the Care for Parents family.